Hey, this is Rachel Hatfield, and I'm here with Dr. Grant with the AutPlay Clinic, and I'm going to talk to him about AutPlay and play therapy and how play therapy has been impacted by COVID and parenting and lots of different topics. Dr. Grant is a licensed professional counselor, and he's created this program called AutPlay Therapy. And basically, what you do is if you're a play therapist or if you're not a play therapist, you can actually get continuing educations towards becoming a play therapist. But if you're a play therapist, you can take this certification and have more insight on working with individuals that might be on the autism spectrum. But he is a licensed professional counselor, national certified counselor, registered play therapist supervisor, and advanced certified autism specialist. So I'm going to turn it over to him and let him talk to us a little bit about what his work is like and what he does.
Okay, thank you, Rachel. Thanks for inviting me. I brought the APT dude with me today to help me with this talk that we're doing. And shout out all the way through to play therapy and all our play therapy colleagues out there navigating these crazy times that we're in. So yeah, thank you. I guess AutPlay is probably primarily my focus, working with kids with autism and related developmental disorders, which could include also intellectual developmental disorder and other developmental disabilities disorders. Probably makes up the majority of my caseload in my practice that I see personally. Children, families, and even adults affected by these issues and diagnosis. And so it's really specialized, I guess you would say. And then AutPlay came about as a protocol to work with some of just the unique needs and issues that kids and families face with this diagnosis. And some of those are play issues, play deficits, and specific unique play strengths, and just how to utilize play therapy to be beneficial for these populations. That's really what AutPlay is about, and how I spend a lot of my time during the week when I'm in the clinic working with kids and with families.
That's awesome. I know I've taken the AutPlay training online. I met Dr. Grant at a conference several years ago talking about autism and his AutPlay program, and just realized how beneficial it was to help children work through things behaviorally with a play therapy model. And so it was so exciting to get to learn about your therapy protocol that you created. How did you end up in this area?
Yeah, well, there's a long story, but I'll make it the short story since we're on limited time. But I got my first client referral with autism, and the long story is kind of how I got that client. But when he came in, a little bitty guy, pretty severely impaired, it was quickly I guess, obvious to me that maybe I was a little out of my element and just not super confident or sure that what I was doing anything. I was a new play therapist, fairly new mental health therapist. So I was pretty grounded in child-centered play therapy, so I started using that with him. But at the time, we didn't really have research on the effectiveness of play therapy with kids with autism. Nobody was really writing about it. In some cases, if people did write about it, they were kind of saying you wouldn't use this play therapy model with kids with autism. And so it was very strange territory, but I really connected with this family, really empathized with them. Something instinctually in me, I guess, said, I do think that play and some of the things that I've learned about play therapy could help these kids. But obviously, I needed that to materialize in a more real way. Um, so I invested. I invested in just education and training to learn more about how are kids with autism getting help? What are the treatments like? What are they doing? And that really started the road toward creating the protocol AutPlay Therapy, where play therapy could be used to help address these kids' issues and work with these families. It's an integrated approach. So it's not just play therapy in AutPlay. It's play therapy methods and theories integrated with behavioral therapy and certain evidence-based practices that we know are effective for working with kids with autism. So it definitely is a blend of what I learned and what I saw working and being effective. And then I started putting that into practice, and it just grew from there. Training started, books started. I mean, and then it was just on, and it's
Yeah.
been growing ever since. Yeah.
Well, it's definitely exciting and a much needed field because we have so many practitioners that are just like what you were whenever you started out, very unfamiliar with the autism spectrum, and working with them in therapy can be intimidating whenever you have no training. And so I think that it is invaluable to have more training in this area and understand how how to communicate better, how to direct people, and use some directive play therapy as well. So. Um, what about is there anything that you wish that you knew whenever you had started out that you know now that you wish that you'd known then?
Oh gosh, probably many things. I consider myself a lifelong learner. I don't think that you ever tap out in terms of what you can learn or get better at or add to in terms of your knowledge base and your skill base. So I probably think of every step along the way, oh, wow, I wish I'd known that even a year ago. So many things. But probably in the very beginning, I think it would have probably been nice had I had, I guess, from the very beginning of my mental health career, a better idea that there was so many different approaches and theories, not just in play therapy, but mental health in general, and just the awareness of getting exposed to all these theories and these approaches, and really finding your fit with what really feels like it resonates with you. Because I think it's important that when you go in and do this work with kids or families or adults, that you're doing something that you believe in, that you're doing something that you feel passionate about. Obviously, we want evidence-based practices, and we want evidence-based treatments, and we want to know, content, and we don't want it to be something random and bizarre that no one's ever heard of. But that being understood, right, then I think it's so important that it's a fit, that it's a passion.
Yeah.
Because I really think you're going to be your best therapist when you're implementing something that really means something to you, speaks to you, and you resonate with it. So knowing that a little more early on, I think would have been good, would have been helpful.
Yeah. I agree with that. I think that as graduate students, we learn so many theories in our theories and techniques class, and it's kind of like you're just trying to figure out one, that's like, okay, this one might be the best one or whatever. But whenever you start practicing and really getting to know those theories, sometimes you pull from each one to try to make them your own. And then whenever you actually find that one that is like, oh, wait a minute, I don't have to reinvent the wheel. It's already there. Like somebody did the work and it's there. I know I experienced that with doing some somatic experiencing work that I'm doing some training in. And I thought, wow, this is what I've pulled from all these other places and it's already laid out. The path is there. So it was really exciting. So I agree with you on that one. I think that that's something that you don't always experience in the beginning, but you have to take time while you're practicing to really find it. Because there are a lot of theories out there, like you said, tons, and you have to really figure out what fits.
Yes.
Yeah. Okay. So what are some of the resources that you had that really helped you on this journey to develop this AutPlay program?
Oh, wow. Lots, actually. And I have to give a lot of credit in the beginning to a lot of people who did a lot of work that were not play therapists. Because again, there just wasn't much going at the time in the world of play therapy or even the greater mental health community. And so I did a lot of trainings and things that were really not considered mental health treatment approaches, like ABA work and floor time and PECs and social stories and the search program. And that really helped me. It helped me see very clearly what people were doing that was being effective with kids with autism, and gaining that knowledge really helped me see how play therapy could be doing these things, and how what we had in some of our play therapy models were constructs that were similar to what was being done in these other treatment programs with kids with autism. So I have to give a lot of credit to those programs and the people who created them and those trainings, because I think if I had not done that, if I had not increased my own knowledge and my own education and training, I wouldn't have even been able to make the connection with play therapy and how it could work for kids with autism.
Yeah, that's awesome. Yeah.
Yeah.
So, what is your favorite memory related to the development of your program and your clinic?
Well, I have a lot of favorite memories, and I've been asked this question before, and I always have certain clients pop into my head, and just seeing them go from a certain place to a much more, I guess, accomplished place in their life, and those memories are always standouts. And they're certainly not like a one moment memory. It's just the progression of these clients and seeing how much they gain and just how it changes their life, really. And those are satisfying memories for sure, and probably my favorites. But I guess if I'm being sort of like just pragmatic in my memories, I would say probably the first time that either I gave an alt play training at a national conference, or when the alt play book was published, because those were definitely milestones. Those were definitely times where, okay, now we're in a bigger audience. It's not just me and my little world and
Yeah.
in my bubble anymore.
Yeah, that had to be pretty amazing to experience, going from all of this hard work that you've done to being at a national training, or I mean, international, because people from all over the world come to those sometimes. So
Hmm.
that's amazing. Yeah. What are some of the things that you have noticed impacting your families and kids that we work with the most with this pandemic and the social distancing?
Yeah, many things really, and it's a wide variety. It in and of itself is a spectrum of presentation, right? Because I honestly do have some families who are like kind of living the high life right now.
Mhm.
They like being at home, the kids love being at home. Their anxiety levels are greatly decreased, and I would not say that they're struggling with much right now with everything that's going on. And then, of course, I have families who are struggling quite a bit. I've got families who have parents on the front lines, working in the ER, working in other healthcare situations where they're directly involved, kids who are not doing so well with being at home all the time and are actually getting stressed out about it. So it's interesting just to even go through a given week and see these different looks, and that it is affecting everyone in some very individual ways. And I think for me, the challenge is, being present with that, like where this family's at, how it's affecting them, what's going on with this child, whether they're loving it or whether they're hating it, being able to support that, and be there with them and look at how their situation is unfolding, for them individually. And then what's my role, in trying to help them through that and support them with that. And I would imagine that people would echo that, that it's different per family, and it's just trying to maintain and be with them and help them through that, whatever it is that's going on for them specifically. I
Mhm.
have not had anyone that I've worked with yet have gotten sick with the virus, or have any family members that have gotten sick with the virus. So I would imagine if you have that, then that's a whole nother, level of issue and situation, that you're working with that family on and dealing with. So I think it can look a lot of ways, but it's in everybody's mind. I mean, whether you're loving it or you're hating it,
Mhm.
everybody seems to be talking about it, and it's on their mind for one reason or another.
Yeah, I think that's true. And it also gives us another dynamic to counseling that we sometimes have, which is countertransference, but it's very rare. I mean, it's not rare, but we don't run into that every single session. And so now we're all going through this, and we have to be careful not to put our experiences on this because we don't know what they're going through. It is individually impacting everyone. It may not be the same experience for you as it is for me. And so still remembering to sit with them in that is very important. So I'm glad you touched on that for sure.
Yes.
Yeah. What are some of the ways that people can look for information for becoming an AutPlay therapist or getting more information about AutPlay?
Well, probably the best resource is the web AutPlay Therapy website, because you can pretty much find anything there on the website that you're looking for, whether it's online trainings or in-person trainings, or the book resources, also contact information. So if you want to email the clinic or call the clinic because you want to get more information or you have questions about how something works, the website would be your one-stop shop for that, and it's just altplaytherapy.com.
Okay.
So really easy to go to the website and discover things. We do have a couple of Facebook pages, a regular AutPlay Therapy Facebook page, and then there's an AutPlay Therapy group. The group is a really nice place right now for resources, because there's a lot of different people sharing resources for ideas in working with kids with autism. It's not just for COVID-19 time, but anytime.
Mhm.
So there's a couple of ways there to get a little more connected if anyone was interested. So and we're happy to answer questions. So if someone does have a question about something, they can call or they can email the main office and we'll respond back to them.
Okay. And I know you have a YouTube page as well, or channel as well. So we'll tag that and
Yes.
links in the comments below too. So
Yeah, thanks for mentioning that. And we post a lot of different things up there, but a lot of examples of interventions, and the focus certainly on the YouTube page is interventions and ideas and information for working with this population of autism and developmental disorders.
Yeah. Okay, that's awesome to have all those resources available. So, what are some ways? Well, I have two more questions, and one is, can AutPlay be used with telehealth and using online therapy?
Yes, and it's a good question because, right, everybody's doing telehealth, it seems like, right now on some level or another. Yes, it can. And I started doing telebehavioral health, I think it was about 10 years ago. I probably need to look this up. And when I started with this first client that I did this with, and it was phone sessions. And interestingly, I remember that there wasn't even the information about telebehavioral health back then that there is now. It's definitely, there was some, and it was a real thing. And, insurance companies were aware of it. We got special permission to, to do these phone sessions from the insurance company. Because this was an adult, not a child, who could not leave their home.
Mhm.
It was not possible for them to. And so this was the only way sessions were going to occur. Um, so that jumped me into the telebehavioral health process. And interestingly, ever since then, I've carried probably 2 to 3 clients as telebehavioral health clients ever since then on my caseload. And most of it has come from necessity. It's been, again, a situation where a person could not come to the office through a medical condition, a physical disability, or something else. And most of those clients were adults. But I have done telebehavioral health with kids prior to COVID-19. I'm on one child couldn't come into the office because of severe allergies, and there was just no way. I mean, it was severe, and so we had to do telebehavioral health. That was a little boy. I've done long-term hospital recovery with teens and preteens doing telebehavioral health. Um, so most of it has been necessity issues prior to COVID-19, except the adults. The adults I've, for a long time, have given the option. It's part of the paperwork. Do you want telebehavioral health? Do you want in person? And then if someone did want telebehavioral health, I would take them through a readiness assessment because it is a different modality, of course, and sometimes it's not the best fit. So I put this readiness assessment together, and if someone was interested, then we had to go through that, and it had to look like they really were going to be an okay fit to do a telebehavioral health process. So anyway, I'm making this a long answer, I know, but yeah. So I mean, when COVID-19 hit, I had already had experience, even with some kids implementing AutPlay as a process, and so it wasn't a new idea. And it does transfer fine because there's this behavioral element in AutPlay, which I do think that the more structured, the more behavioral type approaches probably do transfer through the screen better than non-directive approaches.
Mhm.
Doesn't mean you can't do non-directive, because I know people who are, and they feel like they're having success with it. But in my brain, it's much easier for me to understand that, okay, you're right there now, Rachel. I'm going to just teach you this game we're going to do together. I mean, that to me does feel like it transfers better and easier than I'm going to be non-directive with you in a playtime. So because we have a lot of those structured interventions that we choose to work on skill development in AutPlay, and we're oftentimes involving the parents. So those two elements of structured intervention and parent involvement do tend to make the telebehavioral process go much more smoothly. And so AutPlay does transfer nicely over. Um, the AutPlay therapists that I've talked to throughout all this have not seemed to have too many issues with just kind of transferring on from what they were doing in the office
Mhm.
through the screen. FYI, as a side note, and I think this is a really important one, it is very different to transfer someone from in person to a telebehavioral health than to start from the very beginning in telebehavioral health. Those are two different things. When COVID-19 hit and I had to transfer a lot of my kids, whether I wanted to or not, to the telebehavioral health, it was easier because they already knew me. We already had relationship established. This was just another way of interacting with me, who they already knew, who they already felt comfortable with, who they already had relationship with. I didn't have to try to build rapport through the screen. Now that's different when I start with telebehavioral health with a client. And I just think that's an important distinction, especially if people move forward and start taking on new clients. So from the very beginning, they never know you except like this. Then, there's a little bit more skill in there you need to learn about how do you engage and create relationship and create presence when this is how you've interacted with somebody from the very beginning.
Yes, I agree. I've had the same experience, that it's so much easier to transition whenever you have that rapport. So,
Yeah.
yeah.
Yes.
So what would be something that you would say would or how can families thrive during this time, do you think?
Well, I love some of the resilience that I'm seeing from families. It makes me happy because I do see a lot of families really trying very hard to maintain stability and come up with creative ways to keep things going well in their family and going okay in their family. I see them utilizing what they can, whether it's taking drives or taking walks together, getting outside, kind of creating new rituals in a lot of ways, and also taking care of each other, trying to learn, well, what can I do to engage with my child? Maybe just be with them, play with them, implementing self care. I think a lot of it depends on each family's situation, of course, because it looks, again, different family to family. But I think it's so important to not try to overdo. I think there's a lot of strain and stress that could come in very easily for any family from a lot of different sources.
Mhm.
So making sure each day to just take a lot of deep breaths, go slower, don't overdo it, and make sure that whatever feels relaxing, that feels calming, that there's kind of a priority of getting that into every day. I know even myself and my own family, I've had to do this a lot because I come home from these days where I'm mostly on a screen. I still go into my office and do my telehealth sessions. Um, and I'm exhausted. I mean, it's just, in some ways it's more exhausting. And so I have to come home and be like, okay, I don't have to be super productive tonight, right? Because I'm already exhausted. So let's just relax. Let's have fun. Let's go take a walk. I've put in the time. It's okay if I'm not feeling like maybe I am as productive as I used to be,
Mhm.
because I think there's just a lot out there that's draining us sort of emotionally and mentally right now.
Mhm.
So we need more of that time to kind of rejuvenate.
Yeah. I agree. I did a small slideshow video on 2020 survival techniques for mental health survival through the COVID stuff. So I'll
Uh-huh.
link that in the top because it just talks about doing basic things of cooking and cleaning and resting and making sure that we understand that that is important and vital for our survival. So I
Yes.
I am so thankful that you joined me today during this discussion. And there's the dude again, and we're so excited to have the dude here.
Yes. Hopefully we'll all be excited and be able to see each other in October at the APT conference. We're going to keep our fingers crossed. If
It's
the
so
dude
great.
had fingers, he
Yeah,
would be
keep
keeping them
crossed.
crossed right now. Yeah.
Okay, well, you have a wonderful weekend and thank you so much. If any of you like this video, please remember to subscribe to our channel and like the video, share the content if you like, leave some comments below about topics you'd like to hear about and maybe people that you would like for us to chat with. Thanks again. Bye.
Thank you. Bye.